Welcome everyone. My PhD topic is the assessment of efficacy and safety of natural products in the evidence-based medicine. My name is Dorottya Bastidas-Gergő. I am a medical biotechnologist and currently a PhD student in the Department of Pharmacognosy. My vision is that the evidence-based use of herbal products will be more widespread in the medical practice, and to achieve my vision, my mission is to provide scientific evidence for health professionals to facilitate their work and their evidence-based decision-making when applying herbal products. I have one submitted and two ongoing projects. The first topic is the assessment of efficacy of peppermint on nausea and vomiting, which we conducted with a systematic review and a meta-analysis. In our first project, our aim was to examine the efficacy of peppermint on nausea and vomiting symptoms compared to placebo in three subgroups: postoperatively, during pregnancy, and due to chemotherapy. We conducted our systematic search in November last year. You can see here the hits and the search key. We found in the databases more than 1,500 articles, and after the full text selection, 16 articles were eligible. And now let's jump to the results. In the clinical trials, they use different measurement tools with different range for scoring the severity of nausea and vomiting. In general, 0 means no symptoms. The higher score means more severe symptoms. For this reason, we use standardized mean difference to analyze the effect size. In case of studies with postoperative nausea symptoms, patients were treated by peppermint inhalation. The severity of nausea was measured at baseline and 10 minutes after the intervention. Patients entered the studies when they spontaneously reported nausea. We were visualizing all the results together. If a value falls below the 0 line, it indicates a preference for the peppermint oil treatment. If above, it indicates a preference for the placebo. By pulling data from 4 articles to evaluate the effect, we found that it is significantly different from 0, showing that peppermint oil inhalation is beneficial over placebo in the case of postoperative patients. The confidence interval of the I-square is between 0 and 90%, so we can't talk about the true value of heterogeneity. It is because of the different measurement tools and skills. Concerning the efficacy of peppermint inhalation, at 10 minutes, there is a 0.62 score decrease in the nausea severity score. As the diamond does not include the effect size 0 and it is narrow, there is a statistically significant difference in the effect of peppermint and the placebo group. In the case of the pregnant women, visualizing the results for all the 3 clinical trials together, we can see a pattern over time pointing to the same direction over a 4-day of treatment. However, it is important to note that there is no baseline measurement available for the study of PASHA, and the time measurements for Semmelweis and Jolly's study do not match precisely. The visual scale would seem to indicate that all the clinical trials show a consistent trend. There is no recognizable pattern in chemotherapy, visualizing all the results together. This lack of clarity is likely due to various types of cancers and to the existence of multiple types of chemotherapy agents. It may be observed, therefore, that the inhalation of peppermint oil is unlikely to be generally effective for chemotherapy patients. However, there is a potential for further exploration into combinations of peppermint oil and specific chemotherapy treatments that may provide benefit in some instances of cancer. The manuscript is ready and we submit it to the Phytomedicine journal in 14th of June. It is a D1 journal. The second topic is the efficacy of Elixirium thymicompositum for children with acute bronchitis, which is a protocol of a randomized clinical trial. Acute bronchitis is an inflammation of the large airways of the lung. Although in the majority of the cases acute bronchitis is caused by viruses, there is a high antibiotic overprescription rate for patients with the disease. To reduce the symptoms of the disease, an alternative over-the-counter treatment is needed. Elixirium timicompositum, which is a Hungarian herbal medicinal product, could be a good option as the product is used for decades for the treatment of inflammatory processes of the upper respiratory tract. Its active ingredient is thyme tincture. Our aim is to assess the clinical efficacy and safety of Elixirium timicompositum to ensure its safe and rational use and to reduce inappropriate prescribing in treating acute bronchitis. Here you can see our PICO. The population is children with acute bronchitis. The intervention is Elixirium timicompositum. The comparator is placebo. The primary outcome is the efficacy of the product measured by the bronchitis severity score. The secondary outcomes are the safety and tolerability by the reported adverse events and the necessity of antibiotic use. Our clinical question is Elixirium timicompositum safe and effective in the treatment of acute bronchitis compared to placebo? And our hypothesis is that Elixirium timicompositum as a standalone or add-on treatment alleviates the symptoms of acute bronchitis compared to placebo. We discussed with the clinicians to set up the detailed eligibility criteria, and we would like to include children with bronchitis severity score between 5 and 12. Patients can have concomitant medication use, such as Tantum Verde products. The exclusion criteria, for example, allergy to the ingredients of the product, having chronic asthma, bronchitis, or COPD, smoking, or lung cancer, etc. Also excluded if they used, for example, antibiotics, antihistamine, or steroids recently. Our intervention will be in two arms. On arm A, patients would get Elixirium timicompositum besides standard treatment. On arm B, they will get an identical placebo which has the same taste and color as the intervention but without the active ingredient. The primary outcome will be the improvement of bronchitis symptom score, evaluated by the bronchitis severity scale between the enrollment and after 7 days of the treatment, evaluated on days 0, 4, and 7. The secondary outcomes will be the safety and tolerability by the reported adverse effects, and also the necessity of antibiotic use besides the product. And the third project is the assessment of efficacy and safety of peppermint during endoscopy, which project we conducted with a systematic review and a meta-analysis. Every year, more than 6 million upper gastrointestinal endoscopies are performed only in the US. Improving diagnostic accuracy for the detection of the small lesions is crucial, and suppressing gastric peristalsis can be a way for that. Antispasmodic agents are commonly used to inhibit peristalsis, but they usually come with adverse effects and being unsuitable for elderly patients with comorbidities. So an alternative option is needed, and peppermint oil could be a potential one. Its active component menthol acts as a calcium channel antagonist, and intragastric spraying of peppermint oil inhibits gastric peristalsis with fewer adverse reactions. In Japan, the use of L-menthol during upper GI endoscopy is accepted, indicating its potential benefits and safety. Our aim is to assess whether peppermint oil could be used as a quick-acting, non-inferior, safer alternative of antispasmodic agents during endoscopy. Our clinical question: does peppermint oil improve the lesion detection rate during endoscopy in adults compared to placebo? And to answer our question, we set up our PICO framework. Patients are adult patients undergoing a type of endoscopy. The intervention is peppermint oil as an adjuvant treatment. The comparator is placebo, and our primary outcome is the quality of endoscopy assessed by the adenoma detection rate. Our hypothesis is that peppermint oil as an adjuvant treatment increased the lesion detection during endoscopy compared to placebo. We conducted our systematic search in May 31 this year in 5 databases. You can see here the hits and the search key. And we found in the databases almost 800 articles after the title abstract selection. 128 articles were eligible. We will continue with the full text selection. So here is the progress of the project. In summary, we submitted the first project on the 14th of June, and we would like to finish the other 2 projects this year too. Thank you for your attention, and I would like to finish my presentation with a quote of Marie Curie. Nothing in life is to be feared, it is only to be understood. Now is the time to understand more, so that we may fear less. Thank you.